So today's video is going to be focusing on a systematic review article that I want to go over that's titled Association of Progestogens and Venous Thromboembolism Among Women of Reproductive Age. So first, progestogens are natural or synthetic molecules that have similar effects of progesterone. They bind to progesterone receptors and act as an agonist. Synthetic progestogens are called progestins. And examples of progestins would be like your norethindrone, which is in your agestin, medroxyprogesterone, which is in your Provera, etanogestrel, which is in Nexplanons, and levonorgestrel, which is in Plan B or Mirena IUDs. The systematic review was completed because there had been competing evidence that showed the risk of VTE with certain progestins, like specifically Depo-Provera, showing that there was an increased VTE risk versus not. And here are the main findings of the paper. They found an association of current use progestins and VTE that was dependent on type and dose. The type of progestins that were associated with an increased VTE risk were medroxyprogesterone and norethindrone acetate. So that's your Provera and that's your agestin. So at doses of Provera between 5 and 20 milligram per day, there was an adjusted OR of 2.66. For norethindrone, there was an increased VTE risk both at the low, which is less than 2.5 milligrams per day, as well as the standard between 2.5 and 10 milligrams per day. So medroxyprogesterone, your Provera, increases VTE risk because they upregulate thrombin receptors due to its enhanced glucocorticoid activity. For norethindrone, which is agestin, this increases your VTE risk because the progestin norethindrone itself actually can be partially converted into ethinyl estradiol, around a 0.2 to 1% conversion rate, which means that a 5 to 15 milligram per day dose of norethindrone would result in a 10 to 30 microgram dose of ethinyl estradiol, which is the typical amount found in a combined oral contraceptive. So some of the limitations for the paper include that over a third of the inpatient VTEs, they could not corroborate if the patients were on a anticoagulation prophylaxis regimen. And the second limitation that they note strongly is that they weren't able to confirm if the patients were actually taking the progestin. They were only able to look and see if the patients filled a prescription, but not if they actually completed the regimen. That's the paper. The more you know.